Is diagnosis written on face of patients? And the answer is sometimes yes and sometimes no. As you see, examine and manage more and more patients, more and more of no will start turning into yes over years. With these words, I am Dr. Manish and I welcome you all to another interesting clinical video on Sturge-Weber syndrome. So let's start. Three-year-old male child weighing 12.7 kilos presented with complaint of one episode of seizure 3 days back and inability to move left upper limb since 3 days. There is history of one seizure per month since the age of 1 year. There is no history of fever. There is no history of trauma to left upper limb. There is no history of similar complaint in other family member. On examination, child is sitting comfortably. A purple cutaneous vascular malformation is seen on left side of face. When parents were asked about it, they told that it is present since birth. It is spot wine stain that involves cutaneous distribution of trigeminal nerve. Other port wine stain is present on right side involving right forehead and upper lid in cutaneous distribution of ophthalmic division of trigeminal nerve. Left upper limb in this child is found to be normal. The coincidence of seizures and facial port wine stain should suggest the diagnosis of Sturge-Weber syndrome, which should be confirmed by CT scan or MRI of brain. CT scan of this child is showing focal atrophic changes in left occipital region with foci of calcification in left occipital, temporal, parietal and right frontal lobe. Although MRI with contrast is the imaging modality of choice for demonstrating leptomeningeal angioma in Sturge-Weber syndrome, unfortunately, MRI without contrast was done, which shows focal prominence of left-sided occipital region, sulci, suggestive of mild hypoplasia. Small venous angioma at a right frontoparietal region near right caudate nucleus head is also present. Based on presenting complaints, examination findings and investigations, a diagnosis of Sturge-Weber syndrome is made. Whenever you see patients with Sturge-Weber syndrome, always look for ophthalmos and glaucoma, which is absent in our child. Now let's see how Roche scale classify Sturge-Weber syndrome into 3 types based on involvement of face and brain. Type 1 is facial and leptomeningeal angioma. Glaucoma may be present. Type 2 is facial angioma alone. Glaucoma may be present. Type 3 is leptomeningeal angioma alone. Usually there is no glaucoma. Based on Roche scale, our child fits in type 1. Finally, it should be remembered that management of Sturge-Weber syndrome is symptomatic. Anticonvulsant medication is started in this child, and we will see how seizures respond to anticonvulsant medication in coming days. That's all for now in this video. If you have any queries or suggestions, then do post in the comment section below. If you haven't liked or shared yet, then do like and share this video, and don't forget to subscribe. Thank you.